Thank you. Good morning, everyone, and welcome to today's media briefing. And it's Friday, the 9th of July. Just make sure I've got the date right. Could I ask, while this, briefing is taking place and we're recording, that people keep their cameras and mics off, please, unless they're recording for broadcast purposes. I'm Abby Jakeman from the County Council Comms team, and also with me is Steve Thorne, Comms Manager at the City Council Comms team. And on our panel today, we have Lucy Hubber, who's the Director of Public Health from Nottingham City Council. Welcome, Lucy. And Louise Lester, Consultant in Public Health at Nottinghamshire County Council. And also just to let people know that today we do not have a representative from the NHS. So if you have any questions, you can either contact them directly or we will pass questions on to them afterwards. Lucy and Louise will provide you with an update about the situation across the city and the county. And then after their updates, I will open the floor to questions. So to kick off, I'm going to hand over to Louise to start. Thank you.
Thanks, Abby, and morning, everyone. So I'll give a brief update of the situation in Nottinghamshire. So the weekly case rates in Nottinghamshire up to the 3rd of July are now at 248.2 per 100,000. So this is an increase from last week. It remains higher than the East Midlands average, but lower than the England average. And rates have increased across all of our district and boroughs within the county. And as always, there is some variation both between those different districts and boroughs and within them. The highest rates currently are seen in Rushcliffe and Gedling, and our lowest rates are in Mansfield. And these increase in rates seems to be driven by our 18 to 22-year-olds. And again, that's across all districts, and to a slightly lesser extent also our 12 to 17-year-olds, so still within young people. And as we continue to move to the next stage of the roadmap and we start to see further easings of restrictions, we can still continue to all play our part in keeping those case rates low and reducing transmission. So I'd like to encourage people to continue with all of those measures that we've stepped up during the course of the pandemic and we're all familiar with now. So that includes continuing with your really good hand hygiene, keeping areas ventilated, opening all those windows, and continue to wear a face covering. I'd also like people to continue to isolate if they get symptoms and go and get a test as quickly as possible if they've got symptoms, but also to continue using those really quick and easy lateral flow testings and continue to make those part of their weekly routines. And then finally, for those who haven't had a vaccine yet, I'd like to encourage them to take up the offer as soon as they can if they're eligible. There's lots of availability in terms of walk-ins and appointments to book, and I'd really like people to continue doing that as soon as possible, but particularly as we move towards potentially that 19th of July deadline. Thanks, Abby. I think over to Lucy for the city.
Hi, thanks, Louise. Good morning, everyone. So from the city perspective, it's a fairly similar picture to we've just heard from county. We have continued to see an increase in cases, not quite at the rate of increase that we've had for the last few weeks. So there is the beginnings of some slowing down, but our cases are still going up. So in the last week, we had 1,334 cases compared to 707 the week before. And that gives us a rate of around 400 per 100,000. And that really is a very high rate, much higher than we would want it to be as we're going into the next period of the roadmap. We've also got quite a high positivity rate. So that's everyone that comes and has one of the PCR or standard tests. For every 10 people that have one of those tests, one person is testing positive. And again, we'd really want to see that figure sort of below the 3%. So we are still very concerned around the amount of COVID that there is circulating in our community. And just like you've heard from Louise, we're going to keep on with those 3 asks. So even more important now, as we're beginning to see things open up and as we're moving to the next stage of the roadmap, to remember the things that we can do to try and limit the spread of the virus. We can all wear our face coverings. We can all continue to wash our hands and try and keep our distance as much as we can, remembering to just keep that little bit extra away from people. Try to keep your distance in queues. Try to think about the space that you are in. If you're in a shop or a restaurant, how you can try and keep your distance. All really important and something that all of us can continue to do. Testing, getting tested regularly. And getting tested as soon as you've got any symptoms. Now, I would remind people that the test that we'd like you to have if you've got any symptoms, no matter how mild, is one of the standard PCR tests, one of the ones that you have to book for. The quick test, the rapid tests, are really great at checking whether or not you might have COVID if you don't have any symptoms. But if you've got symptoms, no matter how mild, really important that you go and have one of those tests. And then finally, vaccination. Vaccination is absolutely our way through this next phase and to see us in a good position for the winter. And lots and lots of vaccinations available. All of the testing sites are now open 7 days a week, and you can just walk in. If you'd rather make an appointment, there's lots of appointment slots available for people. And I think one of the things I'd say is all of those pictures of queues that people have seen, we're not seeing that in Nottingham and Nottinghamshire. It can be really quick to go and get your vaccine. You can come, do the admin in just a few minutes, have your vaccine, and then it's the sitting for 15 minutes. So you can be in and out in 20 to 25 minutes across all of our testing sites. If you need to be guaranteed on your time, book an appointment, but otherwise just walk in. If you feel more comfortable coming with other people, please come together to have your vaccine. We can accommodate, large numbers of people. So if you want to come with your family, or if you want to come with friends and be vaccinated together, that's fine. And if you've got any questions about the vaccine, come to one of the vaccine centres. There's lots of people around who can talk to you about any concerns that you may have. Getting the second vaccine is really important, but we're pretty good at that. What we really need is people coming forward for that first vaccine, particularly if they're in the younger age group, 18 to 30. And so if anybody hasn't yet had their vaccine, but is now beginning to hear about that from the 19th, they won't need to isolate if they're double jabbed, come and start that process earlier. Come and get your vaccine now. The sooner you get your first vaccine, the sooner you can get your second vaccine, and you'll have some of those additional freedoms. And that's it from me, Abby, for this week.
Thank you very much for that, Lucy and Louise. Thank you. Just important reminders to us all. Go to questions. As usual, raise hands. Yes, I see a hand up already. One question and one follow-up question, please. And for the benefit of the recording, it will be really helpful if you could state where you're from. And I just want to say sometimes I won't see hands or I'll miss them, but I will make sure that everyone has an opportunity to ask their question. I will make sure at the end that we don't miss anybody. And I think the first hand that shot up today was from Hugh. Hugh, your question?
Morning, everyone. Thank you, Abby. This is to both members of the panel, actually. Obviously, face masks aren't going to be mandatory anymore from the 19th, if that goes ahead as planned. Will each of you continue to wear a face mask in enclosed public spaces? And what would you like other people in Nottingham and Nottinghamshire to do?
I'm happy to go first on this one, Louise. In Nottingham City, we're seeing increasing case rates. And we have got a lot of people that still need to come forward for their vaccine. So I'm going to be encouraging everybody to continue to wear their face covering after the 19th, where they're in places where the risk of transmission is greater. That's in indoor spaces where you can't confidently keep your distance from people. So even outdoors, if you're in a crowd, put your face covering on. And then really importantly, where it provides confidence for other people. So if other people ask you to, then I should be wearing my face covering. So yes, Hugh, I'm going to continue to wear my face coverings when I'm in enclosed indoor settings, when I'm in a crowd, or when it makes somebody feel more confident and comfortable for me to do so.
Thanks, Lucy. And very similar for me, Hugh. So yes, there are circumstances where I will continue to wear a face covering. So includes where I'm required to or where I'm asked to. Again, if I'm indoors or it feels crowded, and that might be a supermarket or other areas, or where I feel it might reduce anxiety for others. Because what we know is that wearing a face covering protects others as well as ourselves. And even if I've had 2 vaccinations, and my risks of becoming ill are much lower, I could still pass the virus on to others. So yes, I will be, and I'd encourage others to do the same if they feel able. But alongside this, I will also be continuing with my asymptomatic testing on a regular basis. And I will, of course, get a PCR test if I get symptoms. So we'll continue with all of the measures.
Okay, thank you both. Hugh, does that answer your question?
It does, yes.
Any follow-up?
Yeah, please. To Lucy, you mentioned vaccine take-up. The city obviously continues to have one of the lowest rates in the country, actually, for vaccine take-up, an estimated 40% of the adult population fully vaccinated, compared to about 2/3 or so in the county. It's something we've spoken about in these briefings before, but I think perhaps before your time as Director of Public Health in Nottingham. So why do you think that is? And is there anything that you can do as Director of Public Health to boost that? Because otherwise, Nottingham's going to be going into this period where restrictions are largely being removed, but with much less protection than other areas, isn't it?
Absolutely. One of the things that we know about Nottingham City compared to Nottinghamshire is that we've got a much younger population. So quite a lot of the job left to do for us in Nottingham is that younger population who have only had access to the vaccine for a few weeks now. And that's been a large focus for us, is really trying to open up our vaccination sites so that people can come in as is convenient for them. We're doing quite a lot of work in the next week or so with some of the youth foundations within the city about how we can get that messaging across, and working really closely with the universities about making sure that those student populations are vaccinated as well, even if they've gone home, making sure that people get vaccinated where they are. But we've also got this group of people who have had access to the vaccine for a while and for a range of reasons haven't come forward to be vaccinated. And so our solution has to take those people into account as well. So quite a lot of the work I've been doing in the last couple of weeks is working with our NHS partners to say, what more can we do and how can we take vaccine to people? So we're shortly going to be announcing a new programme of pop-ups where we'll be taking the vaccine into community settings and working with communities to encourage people of all adult ages to come forward and be tested and get vaccinated. And that's where that offer of coming together with a group, whether it's with a group of friends or group of family, is going to be really important, because we know that can make a difference in people who feel a bit nervous about having the vaccine. Having it alongside people that they are familiar with can build that confidence, and we're really keen to be pushing that message.
Thank you, Lucy. Tom.
Thank you. The next hand up was Joe Locker.
Hi guys, it's Joe from the Nottingham Post. Good to see you again. So my question is to do, obviously we haven't heard anything to do with hospitalisations or deaths as of yet. So my first question is to do with that. So obviously we've been seeing an increase in COVID cases, and the data points towards the Delta variant being the most dominant strain now. So is that translating more into hospitalisations, and are you concerned at all as we go into July 19th?
I think increasing case rates are always of concern for us. What we're not seeing, so Nottingham City is at 400. In February, when we were at these high levels, we had huge pressure on the health service. We're not seeing that. with this current spike, and that's really strong evidence to show that the vaccine works. That very strong, what we thought the vaccine would do, it is doing. It's reducing severe illness, it's reducing death, and that's brilliant news. And that's why it's even more important that we encourage people to come forward and get vaccinated, because we can now clearly show that not only is the vaccine safe, but it's doing its job. But we have to remember that COVID is about more than just hospitalizations. At the moment, cases are still being required to isolate, and after the 19th, whilst close contacts who are double vaccinated won't need to, there are still, particularly as we've just spoken about with young people, large numbers of our community who will still be required to isolate. And we know that that's really difficult for people. And we know that the challenge that brings both to physical, economic and mental health. So COVID is about more than just hospitalisation. So good news that they are much reduced from where we might have expected them to be without vaccination. But actually, we've still got some really big harms that COVID can bring outside of that.
Thank you, Lucy. Does that answer your question, Joe?
Yeah, that's lovely. Thank you.
Any follow-up?
Yes, please. Thanks.
Okay.
So the follow-up is to do with a couple of stories that have gone out this morning, particularly one from ITV. That states, I think it was Paul Hunter stated that celebrations for the Euros has been an important factor in driving up cases. And obviously we've seen the scenes in Nottingham, in Old Market Square in particular. So what are your thoughts on this? As you said, Nottingham City has low rates of vaccination, at the minute. So is that a concern for you going into Sunday? Thanks.
All large gatherings at the moment are a concern for me, but I more than understand that people want to celebrate, particularly after the last 18 months we've had. This is, 55 years worth of pain. So, it's something really worth celebrating. So what we would ask people to do is to just take a minute and think about how they can do that in a COVID secure way. So if you're going to go out and watch the game and celebrate with friends, then please take your rapid or lateral flow test before you do. Know what your status is before you go, and get tested shortly after. Test yourself again afterwards. So in a couple of days' time, test yourself again, even if you don't have symptoms. Really important. Preferably book yourself into a pub. If you're going to go out to watch the game, book yourself into a pub where it's going to be COVID secure, where the numbers will be managed. And think, if you're going to celebrate, outside, just think about trying to keep your distance from groups of people. It's great to be in that atmosphere, and I understand why it draws people out, but to try and stay within your smaller group of 6 rather than joining that larger melee. I think those are the sensible actions that people can take. I don't want to be the killjoy that says, you must stay at home and whatever happens, don't smile, because it's just too big an event for that. So if you're going to do it, think ahead, plan, and do it as safely as possible. Get tested, and if you're not vaccinated, come along and get vaccinated as well. It won't protect you by Sunday, but it'll certainly help us in the bigger battle to come. Is that okay, Joe?
Yeah, just to thanks, Lucy. Just to reiterate, then, do you agree that it's been an important factor, these celebrations, in the rise in Nottingham in particular?
We haven't yet. So if you think about COVID, there's a lag before we begin to see the impact of these events. So it's usually about 2 weeks afterwards. So given where we are in the tournament, we haven't yet seen an impact in Nottingham. We haven't seen a difference between men and women cases. We haven't seen any particular noticeable spikes that we might expect to see it related to the game. But that doesn't mean to say that it hasn't happened. It's just that we've got that longer time lag before we'll see the impact of that. So the message remains, Joe, for people to watch the game, enjoy the game, and celebrate hopefully the win in as most a COVID secure way as possible, by getting tested beforehand, by thinking about how they can maintain social distancing, and just being sensible. Wear face coverings.
Lovely, thank you.
All right.
Thank you. Thank you. I can't see another hand. But Anna, I think you had your hand up at one point. Do you still wish to ask a question, or has that been covered by something else? That's Anna Tyler. No? Okay. I can't see any other hands. But I would say that if anyone has a question, can they just just ask it now? I can't always see the hands on Teams when they're raised. Can't see any others. No, well, okay then. I'm going to take that this was a briefing where everything was covered and all your questions have been answered, which is always good. And I'm just going to go back to the panel and say, is there any final message you have that you want sort of people to kind of bear in mind for the weekend and the week ahead? I will go to, I think I'll go to Louise first.
Thanks, Abby. So I'd reiterate Lucy's point from the last question. I'm really hoping that everyone enjoys the weekend and enjoys the football. And whilst I'm very hopeful that football might be coming home, I would like everyone to do everything they can to make sure that COVID doesn't come home. So that is all of those measures that we're familiar with. That's keeping windows open if we're watching it at home. That's remaining in our groups of 6 if we're together at the pub. That's taking the testing, so the lateral flow testing if we're asymptomatic before the event, and again afterwards, to do everything we can to reduce transmission. And of course, if we're symptomatic, hopefully watching the win at home.
Thank you, Lucy. Sorry, Louise, my mistake. Lucy, do you have any final message for people?
So to move it on a bit from the football, I think people, it would be great for people to start to plan now for how they are going to behave after the 19th of July. So to begin to do that thinking now about what they are going to do to help continue to keep the population of the city safe. And the things that they can do are to get vaccinated. If you haven't already been vaccinated, or if you're due your second vaccination, please come and get your vaccine. To continue to get tested regularly, whether or not you've got symptoms. And if you've got symptoms, get a PCR test and isolate. And to keep wearing your face covering and maintaining some social distancing when you are in an indoor space, when you are in a crowd and you can't keep some social distancing, and when somebody asks you to give them confidence. And those would be my key messages.
Thank you very much, Lucy. Thank you for that. I think that actually brings us to the end of today's briefing. So I would just like to say thank you very much to the panel. Thank you for your time this morning. Thank you to media colleagues who've been coming along and helping us get these messages out to people across the city and the county. Really, really important messages. And, particularly now as we're looking, the end of the roadmap is in sight, but as the Prime Minister himself recognised, COVID hasn't gone away. It's not going to magically disappear, on that day. So all of the things that we need to be doing and thinking about for the future. So I would just like to wish everybody a very, very good weekend. Enjoy the game and watch it safely wherever you are. So thanks very much. Take care, everyone. Bye-bye.
Thanks, Abby.